Micro-invasive glaucoma surgeries have started to have an impact on glaucoma surgery practice patterns. With constantly evolving newer technology, one needs to learn newer skills and also refine the older ones. Mastering intraoperative gonioscopy is the first and foremost step in learning all type of MIGS. Here I share with you common mistakes and the tips to overcome them while doing intraoperative gonioscopy. The surgeon sits temporally to the patient. This is a case where the surgeon is going to perform Cahoog dual blade goniotomy. The microscope is tilted 40 to 45 degree towards the surgeon and patient's head is rotated 35 to 40 degrees away. With this, the working distance between the surgeon and the surgical site increases. Gonio lenses used for MIGS are prototype of Swan-Jacob lens. Being well versed with gonioscopy in OPD and knowing the anatomy of the angle is a must before starting to practice any form of MIGS. This video shows a surgeon performing KDB goniotomy. One can nicely see the angle structures here. How to identify pigmented trabecular meshwork, which is the site of MIGS surgery commonly. One can identify it by its pigmentation or the presence of blood in Schlemm's canal sometimes. Cases where identification is difficult, trypan blue staining has also been described. To get a good focus on the angle structure, the iris plane should be coaxial to the microscope. Hence, the rotation of the microscope and the patient's head or eye in opposite direction is needed. As we can see here in this video, directly placing the lens on the cornea without rotation of the eye gives you no view of the angle. To get an en-face view of the angle, if one faces difficulty, you can try lifting the hand gently, which rotates the eyeball away from you and you can see a better view. Also, holding the lens in non-dominant hand and performing MIGS with dominant hand helps. This video shows that if the amount of viscoelastic substance placed beneath the lens is less, it can lead to creation of bubbles, which can be overcome by placing a good amount of visco there. You may see corneal folds which also hamper the view. This can be seen in eyes which are hypotonous. This can be managed by filling the AC with viscoelastic substance. This also happens if you apply too much pressure on the cornea or the wound. So here you need to recheck your position and loosen your hand. If your view is hampered by blood on the cornea, you need to rinse it and reapply viscoelastic substance. Bleeding from the angles is a potential problem which is even more in hypotonous eyes. Viscotamponade helps in controlling the bleed. Sometimes the view can become hazy due to corneal edema, secondary to cataract surgery, as you can see in this video. Also, if one magnifies excessively, the view can get hazy, so one needs to adjust the magnification accordingly. Thank you.